Hi, I'm Mila Ioussifova. I am a practicing optometrist in Portland, Oregon. I have a full scope private practice, but majority of what I see is dry eye patients. And now I just opened a new practice that is a standalone dry eye clinic. One of the lectures that I co-presented was Dry Eye in Women, Hormonal and Aesthetic Considerations. And the biggest takeaway from that lecture was that when we have patients that we're managing, women with dry eye, we have to think more systemically and also looking at the lifestyle and not just on the ocular surface. So especially our perimenopausal women, as they go through a lot of shifts in their hormones, we have strong evidence that that is one of the contributing and modifiable factors, risk factors in dry eye. Same thing with cosmetics. It is categorized as a modifiable and consistent risk factor for ocular surface disease. So the way that cosmetics are applied and the ingredients that are applied, but also some of the procedures that women may choose to do. So this is what our lecture was focused on, and really giving a lot of the education that our colleagues can take to their practices to be able to manage their female patients with dry eye better. The role of androgens has been very strong. The evidence is strong on the ocular surface. They play a role in meibomian gland function, maturation, and lipid production and secretion, as well as on the lacrimal glands. As women get older and testosterone levels, androgen levels start to decline drastically in 40s, 50s, and before they actually diagnose with menopause, there's a lot of shifts that are happening. This is when we also see the risk or the symptoms for dry eye really increase and rise during those years. Same for estrogen. Estrogen and progesterone, they actually have more of a balanced effect. It's not just estrogen, it has to be counterbalanced with progesterone to have beneficial anti-inflammatory effects on the ocular surface. So when it comes to hormone therapy, and this is an important topic for us to discuss with our women, our female patients struggling with dry eye, because especially now the black label has been lifted off HRT, many of our patients are being prescribed HRT, and it is our role to really help them navigate through that or guide them in identifying some of the concentrations or how it's delivered, maybe more contributing to dry eye versus helping dry eye. For example, when it comes to estrogen and progesterone, again, the balance is what's really been shown to be beneficial. If it's a higher concentration of estrogen, that may make dry eye symptoms worse. And also if it's if it's administered or if it's taken orally versus a patch, oral can increase the symptoms of dry eye versus patch would be more beneficial and less risky for dry eye exacerbation. And then also testosterone, that's where again we see the androgen decline being a big factor in dry eye disease. So having testosterone cream, that's typically how it's administered, how it's applied. Adding that to the education piece that it's not just estrogen, progesterone, testosterone, it also has systemic benefits, but also ocular surface benefits. Our role is to educate patients on the risks and really not tell them not to do something because that's not realistic, but really give them the tools and the education so that they can understand maybe changing the way that they're applying the eyeliner or specific ingredients that can be avoided so they're not exacerbating their inflammation and irritation. So for those patients that are considering doing surgical interventions like blepharoplasty, educating them that there may be some risks to keep in mind and finding the right oculoplastic surgeon that you would be referring the patient to so they understand how to do the procedure and not exacerbate the patient's ocular surface problems like causing like ophthalmos or incomplete eyelid closure. Dry eye could be complicated. It could be frustrating for both the clinicians and for patients if they're doing everything on the ocular surface, with the right drops and the right maybe in-office procedures, but the patient's symptoms don't improve. So this is where it's important for us to really think systemically, and hormones have been shown over and over to play a huge role in exacerbation of dry eye. It can be in perimenopause for 10 years before you actually go through menopause. So a lot of times these women don't realize that they have all these shifts in their hormones, maybe they're not that obvious. So as eye care providers, if we're looking for the risk factors or looking for the root cause of their dry eye, not only would be helping their eyes get better, but also their systemic health as they focus on balancing their hormones, whether it's with HRT, but also lifestyle modifications, stress management, good diet, sleep, and all those things.